Hi, I'm Anthony Originello, CEO of the Chartered Professionals in Human Resources for BC and Yukon. We represent more than 8,000 members, and as the organization dedicated to advancing the HR profession through education, advocacy, awareness, professional development, as well as our recognized and impactful CPHR designation, we are proud to be a sponsor of this show. We have been the voice of the HR profession since 1942. Learn more about us at cphrbc.ca.
In this edition of Careers That Matter, I'm joined by Dr. Brian Day, the founder and Chief Operating Officer, Executive of the Cambie Surgery Centre. Brian, welcome.
Thank you.
What exactly is your job? Like, are you an orthopedic surgeon? Are you a business person? Are you an administrator? Like, what do you do?
Well, every doctor nearly every doctor in Canada is, quotes, a business person, in that they operate their own practice, and that means running an office, staff and overhead and all of that thing. But primarily I'm an orthopedic surgeon. I'm a doctor, and I still am practicing and operate. I operated on 5 patients yesterday. I just like my job.
Huh. So do you have such a thing as an average week? Because to say an average day, probably you don't have a routine on a daily basis, but is there a flow to an average week?
No, I just, every week's different, and patients are different, and the volume is different, and so I would say there's no such thing as an average week, and every thing that crops up during your daily work is new.
Wow. So you're constantly being challenged.
Yes, except, the different levels of challenge. I've been at it a long time, and it's a lot of the patients I see, I can quickly figure out their diagnosis and recommended treatment. Sometimes we get a lot of inquiries through the digital route, whether it be emails or Zoom, we can quickly figure out whether nowadays every surgeon, every orthopedic surgeon is subspecialized, so we can figure out a lot with just a conversation.
You run the company.
Yes.
So you're the CEO.
Yes, I'm the president and CEO of Cambie Surgery's corporation, which operates Cambie Surgery Centre.
So tell me a little bit about the size and scope of your team.
So at our small facility, it's small compared to a hospital, but we're a surgical facility. We also have another clinic called Specialist Referral Clinic, where we where patients are assessed. I think altogether we have 120 specialists who come to our clinics. We have also a significant, a lot of staff, nurses, not so many administrators as the public system in healthcare has, but we have a few administrators. We just run. It runs really well. For a health facility, we are a very happy organization. There's no such thing as, quotes, burnout as there is in the public system, because everyone has one goal, and that's looking after the patients.
You're also an advocate for improving the healthcare system in Canada, so that takes a portion of your time.
Yes, to go back, I was nowhere involved, not involved at all in this in the first 10 years. When I first came started practice, I was just, my interest initially was trauma, accidents. Then I focused on sports injuries, like injured athletes, and enjoyed that. I've treated athletes from all over the world. Patients.
You even got inducted into the Sports Hall of Fame, didn't you?
Yeah, I was the first orthopedic surgeon to be inducted into the BC Sports Hall of Fame. Premier League soccer players used to come over with their physiotherapist for surgery at our facility. I'd operate on them. I've operated on many international athletes, Olympic medalists from as far away as Australia have come to Cambie, and then a lot of, we're known as Hollywood North in BC, so I've treated a lot of famous celebrities. You'll see in the book one of them, whose name you would recognize is well known, Sylvester Stallone. He got injured, believe it or not, once. But yeah, I mean, I enjoyed that part of my work. But then in those early years, I was operating and treating these patients in a timely manner, as all patients were treated in a timely manner at the public hospitals. UBC Hospital focused on orthopedic sports injuries, but that all changed with the rationing of the health system.
Which prompted you to say, I want to speak out against the way in which the healthcare system has been functioning.
Yes, I mean, one of the things that initiated this was I was chair of the academic program for the training of orthopedic surgeons in British Columbia. I was also chair of the Royal College of Surgeons of Canada examination test committee, and we were training orthopedic surgeons for I was training orthopedic surgeons in terms of their academic route in British Columbia, and over a 4-year period of 16 orthopedic surgeons that we trained, only 5 were left in Canada because they couldn't get work. So this was, on the one hand, there were year-long wait lists for orthopedic surgery. On the other hand, we were training them, and the hospitals wouldn't give them operating time. So they were leaving mostly for the United States,
where they could get work.
Yes, and it wasn't just doctors, nurses really. So one of my patients once that had told me he had a hip replacement done at the Mayo Clinic in Scottsdale, and he noted in the operating room that there was a surgeon, another doctor assisting the surgeon, and there were 3 nurses, all of whom were from British Columbia, because had left because they couldn't get satisfactory work here. And as I used to kind of joke, the thing is, there's no shortage of doctors in the United States. The ones that can get work there are the best ones. So if we don't change this, you're going to be left with all the mediocre ones like me. Anyway, that is a joke. I don't really mean that.
Yeah, I know. Self-deprecating humor is a good thing. It's good to remain humble. So let's take a look at your career. You grew up in England.
Yes.
You complete your mandatory school and decide to go on to post-secondary. Did you know that you wanted to go into medicine?
Well, I went into my father was a pharmacist, and he's the one who persuaded me to become a doctor and not a pharmacist, because that's what I was thinking of. And so I went to medical school, and then in the early 70s I came to Vancouver. I thought just for 1 year to ski, but ended up staying.
Wow. So you start working where in Vancouver?
At Vancouver General Hospital as a trainee. UBC Vancouver General Hospital was the main hospital actually it was the biggest hospital in the British Commonwealth at the time, because it had the children's and obstetrics. And I trained there, and then afterwards went on a traveling fellowship after graduation and spent time in Switzerland and England and Belgium and the United States before coming back to start practice in Vancouver.
So what was it about practicing medicine here that brought you back?
Well, no, I was always intending to come back. It was a further specialist training. I just thought, the system was so good, the patients were all being treated quickly, and we just enjoyed our work. There was, as I like to say, things like burnout, we never even thought of that. The nurses were never burnt out, the doctors were never burnt out, because we could do our work. Nowadays, due to the system, we find that patients patients go to the hospital, take their frustrations out on the frontline workers, which happen to be the nurses and the junior doctors and the other staff.
So that prompted you, the changing system, to branch out on your own.
Yes, we had our access to the operating rooms cut back by the administration because treating patients was the cost factor for healthcare, and the hospitals had limited funding. And so a group of us, including some well-known philanthropists who were massive supporters of the public health system. I mean, we decided to build our own facility. Some of our founding shareholders donated well over $100 million to the public health system in BC. There are corridors and buildings and that are named after them. The new St. Paul's Hospital that's being built in British Columbia is being built on land that two of our shareholders held in trust for decades. They bought the land for $20 million. They sold it to the government, St. Paul's, for $20 million many decades later.
Oh, so they did not...
It was worth over $500 million when they sold it. They sold it for $20 million.
Because they were committed to...
They were supporting public health care. And so, our clinic, Cambie Surgery Centre, was not built by patients out, by investors out for a profit. They just believed in it because they had traveled the world and seen that in other countries the healthcare was working way better, and was more universal and more equitable, and they believed it. They believed that the public sector monopoly needed competition. They knew that a monopoly was never good for the consumer.
So you became an entrepreneur. Did you know that you had entrepreneurial drive?
Well, yeah, because my dad was an entrepreneur. He owned his own pharmacy and built that up, and I worked there as a teenager, and also as I said, the doctors, not all of them nowadays, but most of them still are small business people.
Right. Then you became, in the process of all of this, an advocate for change as well.
Well, yes, I became, I decided that politics was interfering with the health system, and so I decided to become a medical politician. And I'd been a long-time member of the Canadian Medical Association, so I put my name in the hat at the very first meeting. I'd never been to a meeting, and at the very first meeting I was elected president, first meeting I'd ever been to. And I tried to, and the Canadian Medical Association period was very productive, but again, it's the wrong level of politics. To make change, you need to be in real politics, where you can actually do something.
Mm-hmm. So if there's a young person who's looking at you and your career and they're inspired, what would you say to them was the most interesting characteristic or trait that you've learned that you have that has helped to move you forward successfully in your career?
Well, I never give up, and that's because, I kind of use the analogy of boxing, because when I was little, like 10, 11, I used to be a boxer, a competitive boxer. And I remember watching the World Light Heavyweight Championship, where a Canadian was taking on the world champion. This is decades ago. And the world champion was knocked down 6 times, came back to win. So you have to get up, when you've been knocked down, get up again and fight. And that's that sport. The other thing about that sport was, it's considered quotes violent sport, but at least in amateur boxing, you get in the ring and box, and then at the end of it, you put your arms around each other and walk off as friends. It's a sport, and you're not meant to hurt the other people. You're trying to just do a sport. And so I think if you're knocked down, get up again, keep going.
Couldn't agree more. Thank you very much.